Good morning and welcome to the Wednesday, November 11th, Let's Talk with Tom and Catherine. I'd like to recognize that today is Veterans Day. We have special activities going on the campus, namely a Veterans Day lunch. And we also have some programs on Channel 22. So either check your TV guide for Channel 22 or just tune it in and see what happens when it pops up. I would like to make an announcement from the Residents Council though. We've been working the last 6 weeks or so at our annual holiday fundraising for the residents' appreciation of the employees. And you've received a letter in your mailbox that had a red envelope. And we really appreciate everybody who has contributed. This year it's running a little bit less than we have in past years. And I think that's probably because we've had some vacancies during the pandemic. People haven't been able to move in. We really appreciate the residents who stepped up their giving a little bit, realizing how much extra effort all the employees have been putting in. This is going to be the last reminder you're going to get, but by the end of the weekend, we're going to be, the fund drive is over for this Christmas or holiday contribution. So those of you who haven't given, or if you feel like you'd like to up your giving that you've already done, you can do it, and all you have to do is stick it in an envelope and put it in internal mail addressed to Mimi Severs, who's the treasurer, and apartment number 1037. So I'm going to turn it over to my sidekick here.
Well, thanks for letting me come along today. It's really hard not welcoming people, but I know my role. So wanted to talk a little bit about COVID in Arizona, but first I wanted to say, we originally talked about today we'd be talking about finances of Westminster Village, but we're going to put that off for a week because I'd really like to have a few people in the audience to ask questions for that. So again, the plan will be next week, next Wednesday. We will do an update on finances, and the following Wednesday we'll probably give an update on the Wyrick Healthcare Center and that remodel. So look forward to those two things. Today we're going to talk almost exclusively about COVID and what's happening on campus and what's happening in Arizona. Arizona numbers continue to tick up. They continue to see that increase. Still not a huge jump, not a spike in numbers, but definitely ticking up in the wrong direction. And then again, what we're talking about doing here at Westminster Village is still on plan with what we've been talking about for the last 5 or 6 weeks, and that's learning to live with COVID, finding the right barriers to put in place and removing some of those barriers so again that we can be back together as a community and get back to the great culture that people that work and live here have grown accustomed to. That again, these barriers that we have, physical and invisible, really have put in place and are changing the dynamics on this campus. So again, we know as the numbers tick up, there's risk out in the greater community, there's risk at Westminster Village, but the reality is there's also other risks out there. So one of the things we're going to do literally starting immediately is those people who leave campus but have no interactions with anybody else. So if you walk around the block and you don't come in with 6 feet of contact of another person, there's really no need to isolate at all. So effective immediately, once this is posted, if you walk off campus and don't, come within 6 feet of another human being who doesn't live here at Westminster Village, you don't need to check in at the front desk or check out at the front desk. You don't need to go on an isolation period. If you drive your car down and fill it up with gas, you don't need to do that. So again, effective immediately, that change is going to go in place. And again, why do we feel we can do that? There's lots of reasons. I think, we're now 9 months into this pandemic. There's been a lot of education on COVID. We don't have as many unknowns as we had early on. Our residents are pretty aware, our staff are pretty aware. We know everybody's making good decisions, and we know people will continue to make good decisions. So it just makes sense to move in that direction. It makes sense for us as a campus to focus our time and resources in areas where there's much bigger risks. So somebody going to get gas is a very minimal risk. It doesn't make sense for us to do the temp checks, to check you in, check you out, to put you on an isolation. There are other times that it does make sense for us to do that, but again, just putting that onus on people to make the right decisions and check in at the front desk when appropriate. We do plan to, on December 1st, make all isolations self-monitored and self-adjusted. So, December 1st, you won't have to check into the front desk at all if you leave campus or when you come back to campus. What we will do is have a sheet of paper that goes out that says, here's our recommended isolation period if this happens. So if you go to a restaurant and you're eating inside, we suggest we recommend a 5-day isolation period in your apartment. If you go to a drive-through and you get your food and you have your mask on and they have their mask on, you come back and you live life as if you never left campus. So we'll have a good set of examples. We have plenty of time between now and December 1st to really write that out and make sure everybody's comfortable with where we're going. But again, the goal is for us to be able to focus our resources on the bigger picture. And again, that's continuing to have the testing available. That's to make sure that home health and our nursing services are available to those that do have an exposure, that have been put at risk. So that, again, we can continue to have a great place to live, and it's a safe place to live. And we continue to encourage residents, just as we continue to encourage staff, to only take risks where it makes sense and you can minimize that risk. Small group activities, wear your mask when you're out. Don't go to places that are overcrowded. Don't have dinner with somebody who's sick. Again, making good choices. And if by chance, while you are out, something happens, that you call home health, let them know, so that we can then put the resources there to keep you safe and keep the rest of the campus safe.
I think that the world has changed, and we're reacting a little bit to that. I have been out, and I isolated when I came back. But every place where you have an interaction with the cash register, a lot of places you can only use your credit card or your debit card and put it in the machine. The place you go to doesn't want to have any contact with you. So the world has started isolating themselves, and we're starting to move back our isolation a little bit. It's interesting how that works out.
Yeah, and again, as this pandemic continues, and again, we see it continuing for a while. I know anybody who's watching the news, Pfizer has now come out and said their vaccine is 90% safe. So we expect to see that rollout be pretty quick in coming to our residents and our staff. Hopefully in the next 60 days, we'll start seeing that be available. Over the next couple weeks, I'm sure we'll start getting the calls to line up our time and exact number of doses. And again, the vaccine doesn't make it 100% safe, but just like some of the other things we've put in place, the masks, the shields with the employees, the education, the testing program, it continues to make it safer. It continues to mean we can, in some sense, get back to more of a normal life and spend more time with each other. And again, it's an important piece that we've been missing on this campus. It's an important piece that's made this a great place to live and a great place to work for 30 years, and we have to be able to get back to that. And we have to do it in the safest possible manner, but we have to get back to that. So again, our goal is to continue kind of the process we've taken over the last 6 to 8 weeks, which is put more of that risk assessment on each of us as individuals, staff members and residents as you go out. Again, effective immediately. If you walk out of the campus and you walk around the block, you don't need to isolate if you didn't come into contact with somebody. You don't need to report that to the front desk. Starting December 1st, you'll report to the front desk if you've left campus and there's a reason to isolate, and we'll get the guidelines out on what that is. But again, that's really going to be up to you to manage that. No longer will that be Westminster Village managing it, unless you're somebody who says, I need help. I need home health to help me manage this, just as we do with the temperature taking currently. We'll still be available for that, but it'll just, again, put that responsibility back on the individual, where at this time it really belongs.
The bottom line on all of this is you have kept the campus virus free so far. We're still trusting you to have, to keep that record going. And while sometimes it seemed tough, it was worth it, if that's what it took.
Yeah, and I appreciate you saying that, but again, it's no one individual that kept this campus safe. It has been the combination of administration and staff and residents and board members and visitors and families. We've all sacrificed to make that happen.
Yes.
Everybody has done a tremendous job. But the reality is we can't stay in lockdown forever. And there was always the risk, even with everything we had in place, that we still could have had the virus on campus, because it just takes one incident. And again, I think we all deserve credit for the work that we did, but I do continue to believe we got very lucky, and we as a campus have been blessed. And again, I hope that continues as we move forward. And again, I'm looking forward to the vaccine coming on campus. I hope that every resident and every staff member will be willing to take that vaccine, because it makes the whole of us much safer. And again, I hope that as we open up some of these things and put that responsibility on the residents and the staff to make good decisions and take good risks where it makes sense and report back when there is an exposure, that people will take that serious. Because again, it only takes one person being out for that virus to get on campus. Again, it's important we all continue to do the things that have helped keep this campus safe. And again, I believe the masks help, the shields help, the social distancing helps. All of those things work. But again, it's really people sitting down and making good decisions and not being afraid to call home health, to send me an email, to call me and say, hey, I was out and I think I had an exposure. What what can I do? Maybe not now to keep me safe, but to keep everybody else safe. And again, the reason I believe we can make this move now is that has been happening literally from day one, where we've had people call and say, had lunch with my son 3 days ago, he called and now he's got a fever. I visited somewhere, this person now has a fever. And again, we need that free flow of information. If you have that exposure, call us. We will jump right on it. We will continue to make sure we as a campus stay safe, and that if there was an exposure, there is not spread of the virus. So that is critical. That goes with that, responsibility of making good decisions, is reporting back when something happens and you hear, hey, there is a risk. Somebody at dinner now has a cough, now has a sore throat, now has a fever, now tested positive, so that we can continue to make it safe for the rest of the campus. And again, as we go to December 1st, we're not saying there's no isolation. What we're going to be saying is it's really going to be up to you based on some guidelines to decide and make sure that you do that. It's not going to be a forced thing or a monitored thing from administration. So again, that responsibility spreads a little bit further to the individuals as we open up and take some of these barriers down. But the responsibility is still there because the virus is still there.
We've been waiting for the day when that happens, and it's been a little while coming, but again, we haven't had the virus, so whatever you've done has worked.
Yeah.
So are we gonna see any other changes on campus?
Like what?
Oh, like maybe changing the reservation policy at Ocotillo.
Yeah, so we'll see that. I'll talk to Mike this week, and that'll either happen in the next week or two or before December 1st, where we'll go to reservations are suggested as they were previously, but not required. We'll probably still see no bigger groups than 4 at a dining room table. Again, the research, the science shows that the biggest risk is while people are eating, because obviously there's no mask, there's talking, there's just a bigger risk of spread. So we want to keep those numbers down, just like we want to keep the group event numbers down. We want to have them, but we just need to have smaller groups. And again, I think we're going to continue to see that probably for a month or two after the vaccine is out. I'm hopeful once the vaccine is out, we'll start to be able to get back in the larger groups.
That would be welcome too.
Yeah, it's one of those things I miss most, and I didn't know I would miss that at the beginning, but having the Let's Talk with 30, 40 people there, having the resident association meetings with 100 people in the room, it's amazing how much you miss those things. Or even just, again, we the staff, part of the barriers we did was we pulled back and didn't have those interactions with residents unless you were a direct care giver. And again, it's one of those things that sometimes you don't know if you'll miss it, but once it's gone, you definitely miss it. It's a part of the reason most of us do this job. It's those interactions. It's that opportunity to make a difference in somebody's life. And when you're stuck in an office, you don't feel like you do every day.
Right.
So, other things we'll see. I know we talked about this, I think, last week, and I didn't realize this was the hot topic on everybody's mind, but yes, we will see the beard go away. We'll see the mohawk go away, although it's getting kind of long. We'll see the
mohawk is going to change to a man bun.
No. I have low standards, but I have standards. So that won't happen. There's not time for that to happen.
I'm bringing I can convert one of these into a rubber band. Now I'm flustered.
I know, yeah.
You're worried. You're worried that it's going to happen.
I'm not worried it's going to happen. But we are, and we've, again, part of that process has been getting back to looking like the campus we were prior to COVID. Updating, we got repainting to do. We've had patches of the walls, getting rid of some of the plastic and putting in something more permanent. It's getting us staff members back to the way we looked again. It's getting out of the jeans and again, having that professional appearance and not being able to use the crutch of, well, it's during COVID, we can relax our standards because we're spending so much time on this other stuff. Again, it's time for us to be able to do both those things. Live in the world of COVID and move forward and keep people safe, but also get the healthcare center remodel up and going. Look and feel professional. Move forward with our strategic plan and get back to the culture that we that brings us here.
Right. And we have a lot of new people moving in kind of all at once. And it will be nice to be able to interact with them in a little bit looser environment.
Yeah, absolutely. All right, so Megan now has some software, so she's probably going to cut out the 20 minutes of me sitting here with a red face thinking about a man bun out of the video, hopefully. But if not, hope it was
Stay
enjoyable.
tuned for next week.
But yeah, thank you.